Thank you. Should qualify, it's actually multi-award winning journalist.
Two.
Yeah, two, yeah. As one of the only 4 journalists in Wales, that's actually not very much of an accolade. Diolch yn fawr galon I chi gyd, dwi dysgu Cymraeg, but I'm not there yet, so please bear with me. Firstly, I want to say thank you to everyone for coming. It's really great to see you all here. As someone who spends a lot of their time on social media because of their job, it's going to be really nice just to talk about ideas and policies rather than how much we hate each other. So that's very exciting. And as someone who spends all their time trying to make people interested in Welsh politics, the fact that people now are is frankly terrifying. So with no further ado, I'm going to introduce each of the panel, or rather they're going to introduce themselves, these very brave people who have given up their Thursday night to speak to us. Let's work our way down the panel, please. Ruba.
So my name is Ruba Sivanyanam. I am currently a councillor and cabinet member in the Vale of Glamorgan. My brief isn't health or social care, but my brief is around legal services and equalities and participation. And I am a candidate for Welsh Labour in the seat of Caerdydd Penarth.
Mabon.
My name is Mabon ap Gwynfor, member of the Senedd for Dwyfor Meirionnydd for Plaid Cymru, and I'm also Plaid Cymru's spokesperson on health and social care.
Ian?
Yes, I'm Ian Chandler. I'm a county councillor in Monmouthshire and cabinet member for social care and safeguarding there. I'm also a candidate for the Green Party in Sefydlu Torfaen and the Green Party's health and social care spokesperson.
I should just say, if you're coming in now, we're starting early, so you guys just come in. You've got nothing to be embarrassed about. Steve.
Good evening. My name is Steve Aitchler. I'm the Lib Dem lead candidate in Blaenau Gwent, Caerphilly Rumney. Neither am I the Lib Dem spokesperson for health and social care. So I will do my best to talk about our policies in as much depth as I can.
So the eagle-eyed amongst you will notice there is no Reform or Conservative representation here. They were asked, they were invited, they were given plenty of notice, and unfortunately they weren't able to attend tonight, which is obviously disappointing because we want a well-rounded debate on something that is one of the most important things to the people of Wales. So it's a shame they're not here, but we crack on. We've got a fantastic panel. So to start with, what we're going to do, I'm going to give each panellist a minute and a half just to set out their opening salvo, set their stall out for what their party would have planned for health and social care in Wales. Let's start in the opposite direction. Steve.
Taking me by surprise there, Will. We're sat here with an invite from the Bevan Commission named after Aneurin Bevan, who was the founding person behind the NHS and formed that social contract between government and people. And that social contract is at real risk at the moment from being broken. When we go to access health and social care services and they are not there, when people call an ambulance and it doesn't turn up, when people are stuck in a hospital bed because they can't move into social care, that contract is broken. And that drives people to look to extremes for answers. And that's a dangerous social situation for us to be in as a country. I'm proud to be representing the Lib Dems. We've got a strong record in Westminster and in the Senedd of championing and supporting health and social care. Ed Davey himself is a carer, and he's championed unpaid carers, fighting for the carers allowance, fighting for a higher minimum wage for care staff. We also do the same in Wales, and let's talk about the NHS in Wales. It's an organisation which is being squeezed from both ends. Failures in primary care and failures in social care, which is putting a huge pressure on the squeezed middle, and it's lurching from crisis to crisis. So we need to solve those problems, and that's going to take long-term planning, and we need to fundamentally look at how we plan NHS services and social care services for the long term to face those demographic changes which we're facing. But there's also an urgent problem. There are a lot of beds blocked in social care, beds blocked in hospitals because there simply isn't social care funding. We think the money should come from Westminster to do that, and the Lib Dems in Westminster have put forward plans for a digital services tax and a tax on banks, which would free up the money to do that. but it doesn't look like that money's forthcoming. So what we're standing on in the Senedd is to solve that social care crisis. As an emergency measure, we would look to increase the Welsh rate of income tax by a penny in a pound. That would give us £270 million per year, which would go directly into social care to free up those beds in the NHS so that we can start to solve this crisis.
Thank you, Steve. Mabon.
Chwarae iawn, Will. Well, we often look at the past through a rose-coloured lens. But when it comes to health and care, the uncomfortable truth is that outcomes were better not that long ago. 15 years ago, the NHS in Wales and across the UK was ranked amongst the very best in the world. And that wasn't by accident. The NHS was founded not just to treat illness, but to prevent it. It's no coincidence that Aneurin Bevan served as Minister for Health and Housing. He understood that your job, your income, and the quality of your home shape your health long before you ever go to see a doctor. Today, we're drifting away from that founding vision. The NHS risks becoming a national hospital service, reactive, overstretched, and focused on crisis rather than prevention. If we want to secure its future, we must go upstream. That means investing seriously in prevention, strengthening primary care, and properly valuing social care as an equal partner, not an afterthought. We don't fix a system under pressure by applying sticking plasters. We fix it by redesigning it around people well. That's the conversation we need to have, and I'm looking forward to having it with you all tonight.
Thank you. Ian.
Yeah, thanks. Wales doesn't need more of the same in health and social care. We need a fundamental shift in our view. For too long, our NHS has been structured as an illness service, reactive, fragmented, and focused on treating symptoms once people are already unwell. And that model's not built for the scale of chronic disease and mental health need and demographic change and above all, inequality that we now face. So the Green vision is different. We believe the core purpose of our health and care system should be human thriving, keeping people well, extending healthy life expectancy, and placing the whole person at the centre of every decision. Their housing, their income, their relationships, their mental well-being, and their community. Prevention must become the organising principle of the system, not as a slogan that is often bandied around and has been for years, but the way we allocate resources, the way we measure success, and the way that we hold institutions to account. And that means shifting that accountability from how many services are delivered to whether well-being is actually improving. It means fully integrating health and social care and investing in early years, tackling poverty as a public health emergency, and supporting unpaid carers and using digital innovation to intervene earlier and smarter. And that's not only morally right, but it's economically responsible because we know that prevention delivers returns that treatment alone never can. Wales already has the foundation, the Wellbeing of Future Generations Act. What we need now is the courage to build the system around it. Thank you.
Thank you. Ruba.
So health is shaped by the conditions in which we live, our income, our housing, our early years for our children, our work and our communities. And that's why Welsh Labour has always focused not just on healthcare, but on the root causes of ill health. Wales has faced 14 years of austerity, yet under Welsh Labour, public services, the NHS, schools, social care, has been protected and I would say strengthened and modernised. We've served over 50 million free school meals to primary age children, invested £1 billion in school buildings, cut NHS waiting lists, created 9,000 new social homes, reclaiming properties that would have been left unused. These are the determinants of good health and well-being. Even through the toughest decade of austerity, we protected vital services, free prescriptions, free hospital parking. 27 conditions now can be treated in your local pharmacy. We've delivered 400,000 NHS dental appointments. So this is the difference that a Labour government makes, protecting services, as we have done for the last 14 years, when the pressure is at its highest. But now is our chance to innovate, to create a healthier, fairer Wales for everyone.
Thank you. So it seems we all agree, actually, that we need to... apparently, we need to look into preventative healthcare. I think you've all read the Bevan Commission's latest releases. So what we're going to do now is we're going to go on to questions from the audience. So each member of the panel will get 2 minutes to answer this. If you see me doing this towards them, it's not a Boy Scouts thing. It's saying they've got 30 seconds left. We will mix up the order as we go along. So our first question is on governance and accountability, and it comes from Sally Anstey.
Good evening. My question is a very simple one for you all. Should health and social care be taken out of political control? It appears to be used as a political pawn, with each new government changing the focus and priorities, with limited acknowledgement of what has gone before, and importantly, how it will impact on us, patients, and the general public. Thank you.
Thank you. We'll go first to Mabon. If you were to win a majority, you're going to take political control away from health and social care?
No, I think you need accountability and leadership, and that's where government comes in to show that clear leadership. The problem we have at the moment is we are seeing a lack of leadership when it comes to health provision here in Wales, and the government have had a sort of arm's length relationship with health boards and with the trusts. And when something goes wrong, they deny any responsibility. So there's no answerability there. So we need to make sure that government takes responsibility. But I think there's a deeper question here around the broader governance of our health boards and the way that health is governed here in Wales. And there's a structural problem. We've seen that with Betsy Cadwaladr. One of the fundamental problems is lack of governance, clear governance there, where there are too many targets being set on health boards. There are no universal structures across Wales with the same outcomes expected in different parts of Wales. We need to see that universality across Wales, making sure that if you go to a GP in Ynysmôn or a GP in Newport, you expect the same results, that the same level of data is gathered and used, because at the moment there's no consistency of data gathering, and there's a lack of data gathering. So there are issues there around governance that we need to improve, and that's where I think I would certainly put the initial first 3 months of being in government, the attention there.
Thank you. Ian.
Yeah, so it's an interesting question, and it almost encourages, I think, politicians to suddenly start talking about structures, and then I just think back to Andrew Lansley and the Conservative NHS reforms in England back in 2010, and where a huge amount of effort and demoralisation went through in just actually changing the way that things are managed and stuff, and actually made no difference on the ground in terms of patient care. So I'll be very reluctant to drawn into that. And I do think, though, there is an issue around, not that taking it out of political control, because I think, you know, I'm a Democrat. I believe in the power of democracy and accountability to people. But I think it's about making sure that the political control, both at Senedd or at Welsh Government level, is focused on the right things. It's focused on the outcomes we're trying to achieve. It's focused on the resources that are available in order to achieve it. But actually, there is more accountability that is brought down to the local level, accountability to patients and to residents, and accountability to the practitioners working in the health and social care service. Because I think, you know, as Mabon said, actually, health boards, the accountability of health boards is pretty weak. I mean, we have the boards in place, but they're not really, there's not a huge link to the public for them. Obviously, social care, there is a greater level of accountability through elected councillors, but even so, it's still at a fairly superficial level, I'd say, because so much of it is statutory services. So I mean, I think it's a tricky one, but I think for me, the biggest issue is about being clear about where the priorities are and making sure the resources follow. We have so many great strategies, plans, workforce development strategies, all those types of things, none of which are resourced. And the accountability for me is actually with the Welsh Government. You come up with all these promises. Where is the resourcing? Where is your accountability in driving this forward? And that's what we've really got to change. And that contract with the people has got to be much more honest, and it's got to be more transparent, and it's got to deliver results on the ground.
Thank you. Ruba.
So I agree that there needs to be political accountability. I think people expect, they expect to have some kind of accountability and responsibility to with the people they elect for the NHS. But, you know, Betsy's maybe a case in point, because actually there, from what I understand, there are 3 hospitals that don't talk to each other. There are issues about the clinicians not wanting to have change. And I do think we need, at some point, a minister needs to stand up and say, this is, if you can't deliver me this, I'm going to, you know, you're going to have to deliver it according to what I tell you, if you can't come to a decision about that. So I think responsibility has to lie with the people, so that they can see the lines, and it is transparent about where that responsibility is. But I think there does need to be, and that is happening now. We are making progress as far as you know, getting people to talk to each other. So getting social care to talk to health, to talk to education, so that, you know, children have one plan going forward if they have particular needs, and that people who to get people out. Oh, you want me to stop now, don't you?
No, I want
sorry.
to carry on.
And you know, reablement services, for example, where you're working with partners in the community as well as social care and hospitals to get people out of hospital more quickly, so that they can be rehabilitated in their home. In the Vale of Glamorgan, for example, we've recently won an award for the reablement services that, you know, it's a very small part, but it's shown how we can work in partnership with our communities, with the hospital and with the council to enable that to happen. And that's what needs to happen, and that's the accountability that people want to see.
Okay. Thank you. Stephen? Steve, sorry.
Thank you, Will, and thank you for the question, Sally. I think you're probably going to hear quite a lot of agreement this evening in terms of that focus on primary care and problems in social care. And I really hope that when we get to the next Senedd government, which will last for only 4 years, there can be some depoliticised long-term planning for health and social care in Wales. Because to solve the problems of health and social care is going to take longer than 4 years. It takes longer than 4 years to train a doctor. You might just about get somebody through an undergraduate degree in 4 years. So I hope that this agreement can continue, and we can depoliticise that long-term planning, so that the next government will inherit a plan which is in process that will tackle those long-term problems. But I don't think we can depoliticise the day-to-day management, and I think it's essential that there is that accountability by ministers as what's being delivered on the ground. And I don't think we've had that. We've got a current First Minister who was the Health Minister and was in charge over a declining NHS in Wales. And I don't think she's been held properly to account. And that needs to happen. Just to give one example, Aneurin Bevan has been put onto grade 4 of special measures for their budget because they're going to go over budget. But what hasn't been provided to them is the information that is supposed to be provided from the minister as to how they're supposed to deliver the services without going over budget. That hasn't been provided to them. And they're going, well, how do we solve this problem? So there has to be that ministerial accountability, and that has to be political, because it has to, as Ian said, go through that democratic system.
All 4 of you talked about transparency there. We've got a little bit of time because we started a tiny bit earlier. I just want to ask, does anyone want to put forward how NHS would be structurally different after 2 years of your party running the Welsh Government? If anyone wants to jump in on that?
The one thing I did fail to mention, maybe not answering directly this point, but something that is equally important is empowering the voice of the patient. Now, culturally, within the health and care service, but primarily the health service in Wales, we've seen health sector and especially hospitals refusing to take responsibility when things go wrong. And there's a reason for that. It's a cultural issue behind it. So if we empowered patients and making sure that Llais is empowered and has a greater say and has direct meetings with the Minister, for instance, has direct input into the way that the board is run, then you're going to see an empowered patient voice, making sure that they are the health boards are more responsive. So that's a crucial part to making sure that there is answerability, and that would improve outcomes.
So not necessarily different, just doing what's going on at the moment, but better.
Yeah, I've been talking to the health boards quite a lot over the last, as you can imagine, over the last couple of years. And we need to make sure that they can function within the powers that they have and the structures that they have. If we immediately went to restructure things, get new boards in place, change the footprint, that would take the attention away from the outcomes, and it would cost a lot at the same time, while at the moment we need to make sure that the focus is on improving outcomes rather than changing the deck chairs.
Okay, I'm going to move on to another audience question. This one is on service sustainability and reform. Reform with a small r. This is from Chris Dawson-Morris.
Yeah, thanks, Will. And I've already confessed to Will that I was listening to the 4 Wales, Sea Wales podcast on the way here. I'll plug it because you probably aren't allowed to.
How much
move on
did
to
he
the
pay
next
you
question,
to plug that one?
Excellent podcast for those who want to understand in a really easy way more about Welsh politics. But yeah, so my question is this really, that we're going to see a massive democratic change, yes, potentially. We're going to see a massive demographic change over the next 10 years. You look at the Bevan Commission report and it says that we're going to shift from 3 to 1 down to 2 to 1 in terms of working age adults. That means that we simply won't be able to staff the care services that we have now. So will you be open and honest about the radical service consolidation that will require?
Okay, we're going to go first to Ian. Ian, you're going to be really clear with the public about the kind of demographic time bomb that's coming?
Yeah, I am, and I think I already am. I mean, obviously, I know Chris, and we work together in Gwent on this, and it is a real issue, and certainly where I am in the area I'm responsible for in Monmouthshire, we see ourselves at the coalface, if you like, of that demographic time bomb, because we already have a much ageing population, and predictions through our population need assessment in terms of the doubling of people with dementia over the course of the next decade. It is a huge issue for us, and we have to be honest, and that's why, and I know we all talk about prevention, right? Everybody talks about prevention, but nobody's really doing it. And we're really trying to shift our emphasis on that, but we need more investment in order to do it. Because we do have to work with our population to get them more physically and mentally and socially active to maintain their healthy life expectancy, to stave off or to minimise or mitigate the need for them to going into statutory support, whether it's through social care or health care, in order to make the system sustainable. We have to do that. And to me, I think that's a moral obligation to do that. But it's not going to be easy, and it is going to be demanding of resources, and we will have to put more resources into it, because other than that, we're facing that other prospect of actually rationing resources, rationing care, or charging more for care, which is effectively rationing it for those that can't afford it. And I am not willing to go down that route. We have to invest in that. So obviously, it's not a devolved issue, but in terms of taxation, as a Green Party, we're looking at wanting to tax wealth in order that, that other parties seem to be avoiding that. There is a huge opportunity to tax wealth to an extent that is not going to make a huge difference to the wealthy, but it is going to make a huge difference to the 99% of people that actually need the public services that we're dependent on. So that's what we would try and do.
Steve.
Where to start? Shall I start with the workforce plan, value in carers, or shall I start with the I word, because reform aren't here? Immigration is probably the elephant in the room to answer your question. Immigration is good for Wales, and immigration is part of the solution to some of those problems. The other part of that solution is a credible, realistic workforce plan that works with our training providers and our universities to train and value the staff of the future. It's no surprise to me that when Cardiff University, where we're sat today, got to that point of desperation where their funding, they looked at their funding and went, we can't survive, and they looked to cut courses. The headline course that they looked to cut was nursing. I don't believe they ever really wanted to cut nursing, but they really wanted the Welsh Government to actually pay some attention to the state of our universities and the state of medical training in Wales. It's underfunded, there aren't enough people being trained, it's not thought through. That's why we've got paramedics being trained in Swansea who then can't get a job. So we need that credible workforce plan, and that's a long-term plan. We need to attract staff, and we also need to retain the staff that we already have by looking at the current workforce pressures, especially in primary care, GP services. Another area is valuing those unpaid carers, which is something that Lib Dems have been championing for a long time. Currently, there's over 300,000 unpaid carers in Wales who are absorbing the pressure of that system. If we don't value them, if we don't provide respite care for those carers, then all of a sudden that demographic shift becomes an even bigger problem, because actually more of us are going to become unpaid carers as that demographic shift takes place.
Thank you. Ruba, do you think that the public are aware of just how much change is going to need to happen in the coming years?
I think people are aware that there is a time bomb. I know in the Vale of Glamorgan, for example, we have we've got a growing older population, and our social care budget, for example, is where most of our budget goes to. It goes to social care and education. So I think people are aware of that. I think the fact that that's going to, that as the population gets older, that will, get bigger, that problem will get bigger. I'm not sure that people are fully aware of that, and we do need to have that conversation with people. But the other conversation we need to have with people is the fact that there isn't, we're not sitting, that Rachel Reeves isn't sitting on a whole stack of money somewhere that she's not giving us. Okay, we've had the best settlement that we've had since devolution from a Labour government in Westminster. It is about prioritising what we do. It was mentioned that you need to change some of the ways that we're thinking about delivering that care, and we're already doing that. So that does mean more joined up thinking. It will mean that people will need to, maybe travel, have specialist hubs for healthcare, where you may have to travel a bit further for specific, very specialist issues. But you can have, as I mentioned earlier, there are 27 health issues that can be dealt with in pharmacies, which could be done nearer our homes. So there has to be a cultural shift. People are going to have to start looking, and that is a real conversation, because people are resistant to that. I want to be treated near my home, but that may not always be possible, especially for really specialist care. So we do need to have that conversation. And for me, it's not about resources only. It is about looking at joined up ways of working. It is about having a cultural shift so that people are prepared to travel. And national care standards. We do, that is something that the Welsh Government, the Welsh Labour Party are very much behind. We had the National Care Service report some time ago, and that, in that we are committed to standardising people's, income and so on for care workers. So that does need to happen, and we do need to have that, and that will make it more of an appealable, job and career.
Yeah, I appreciate you're in the unenviable position of actually having power, which is...
I don't have any power, can I just say that?
your party has plenty of it. And do you think that your party in Wales has kind of made clear just how many more health and social care stuff we're going to need? Do you think people are kind of, that is filtering through? Do you think that's a narrative that you guys have owned? I
mean, that's an interesting question, isn't it? Because, I started this by talking about the determinants for people's well-being. And those determinants are about, having, creating, better jobs. A thriving economy will create better, more well-being for people if you have, if you have a good job, if you have a home, and, your community is thriving. Those things will affect people. So I think our narrative, Welsh Labour's narrative, isn't always as strong on emphasising those particular issues, that all of those are part, that's part of being a marmot, we aspire to be a marmot nation. That's part of that discourse. And that, I think, we do need to have that conversation louder.
Mala, your party is leading in the polls at the moment. If you were to, do you think you're being clear with the public in Wales about not just the challenges that are here now, but also about the challenges we know in 20 years, 15 years are going to be here?
I don't think that we, not as a party, but in general, politicians have been clear about the problems facing us. I was discussing this earlier. There's terminology in business where they talk about the black swan and the grey rhino, right? The black swan is your sort of COVID, something unexpected, but it happens and it has a significant impact. The grey rhino is a big beast of a thing coming down the road towards you. You know it's coming, and the task is to move out of the way. In this instance, we've got diabetes, we've got obesity, and the biggest determinant of health is age. And we know that we have an ageing demographic. These are all coming down the road towards us, but what are we doing about it? What are we going to do about it? And that's the challenge for us. And that's why we're talking about, and I'm glad to hear all of us here talking about the need to shift left towards that preventative agenda, making sure that things are in place before things get wrong. But the problem is that we've not seen that shift. In order to get that shift, we need to get more resources into primary care. And I'll give you an example of how that can work and how it's not working at the moment. There's a surgery in Llanfyllin, in the north of Powys. There are 4 surgeries there, actually, GP practices. They serve around 12,000 people. They've done some fantastic work in stopping elderly people from falling in, from the frailties that they might suffer from, making sure that the doctors visit these elderly people up the valleys of Powys. But because they're not funded properly, they are having to cut £400,000 and cut one of the surgeries there, the GP practices. That means that they will have to cut some of those frailty services, which will result in more people going to hospital. Now, if we manage to shift resources from the hospital-based care that we have at the moment into primary care, primarily into GP surgeries, then we would make sure and we would be able to stop a lot of those breaks and falls and the frailty issues and stop those expensive hospital admissions before they happen.
Okay. Going to go on to another question from Claire Williams now. Claire isn't here today, so I'm going to ask this on her behalf. I'll be going to you first, Ruva, on this one. The NHS is reliant on a sustainable social care system as capacity and workforce issues in social care have implications on patient workflow. Will your party commit to developing a long-term agreement on the sustainability of the social care system to include funding and resourcing?
Well, I've already discussed that. So around social care, I think we do need to standardise pay. That doesn't mean that we won't have any. I think there are plenty that in Cardiff Penarth. I know that there are private suppliers of care workers who are appalled at that some other private firms are not paying wages properly and so on, have appalling circumstances. You know, I meet those carers under those conditions. So that standardisation, that work is already starting. So, you know, for me, that you know, I feel like I'm repeating myself, but you know, that standardisation needs to work. But we do need to, as I said, there isn't lots of money going to come from somewhere for us. But I think if we if we look at you know, more joined up working, you know, which is happening. I've talked about the Vale of Glamorgan, but that, you know, that's replicated, you know, in other places. And I think we can all, you know, you know, there are, I can't remember, something like over 1.5 million GP appointments every month. So some people, and we're 3 million people in Wales, so people are getting GP appointments, for example, somewhere. So these things are working now, but we do need to, I've talked about the culture, there does need to be a cultural shift so that we do more joined up thinking between, for example, you know, the NHS, hospital services, GP services, and social care. So yes, I am committed to that, because I'm committed to that working better. Would I like to have a money tree to put more resources in? Yes, I would, but I also want to give people better jobs. I also want to put money into early years so that children, I think there's evidence to show that the £1 that you spend in early years for children is worth, you know, £4 or £5 later in life in terms of health and educational outcomes. So for me, I want to spend money in all of those areas. So yes, I do have that commitment, but as well as all the other areas.
I appreciate dropping that question on you first. It's very mean of me. But just to be clear, on that kind of commitment to that long-term sustainable plan, Labour get back in. You've got another 4 years. By the end of that 4 years, will there be a long-term sustainable plan for how we properly resource and fund social care? So it won't be this patchwork. Actually, people will go, right, this is the plan. This grey rhino is running at us. This is the plan for how we're going to navigate it. Will that have happened after 4 more years of Labour?
Well, you know, I wouldn't necessarily put it in terms of a grey rhino running towards us, because I think, well, I don't, because I think we're already delivering on some of those things. So we are already, you know, looking at those standards. We're already delivering services which are more joined up and which are delivering for the people of Wales. So, you know, for me, that scenario isn't. Yes, I agree that, you know, as I've said already, that, you know, that these are things that are going to, you know, are going to, you know, get bigger. But I think we have a plan that will move us forward. That isn't just about, you know, pumping more money. But obviously, if there were more money, I'd give it to them.
To me, fantastic. I'm freelance. I could very much do with that. Mabon Abgwimble.
Yeah, we need to fully integrate health and social care. That's the simple fact of the matter. And I'm proud that Plaid Cymru, when we were in an agreement with the Labour government, started on that process. It's not yet finished, clearly, because we're still seeing that gap where people get lost between either the health board or local authority. And, you know, I'm hearing stories from local authorities across Wales now that they are employing lawyers to fight health boards in order to get a CHC package in place. That's clearly wrong. You know, it shouldn't be the case that nobody's willing to take responsibility and someone's suffering in the meantime, but that's what's happening. So if we, and that's what will happen under a Plaid Cymru government, we will move towards that integration of health and social care. But I was in Morriston Hospital last week, and it became obvious when I spoke to people there that this problem that we have seems such a big problem, right? But if you think about Morriston and the tens of thousands of people that walk through that hospital on a weekly basis, of those tens of thousands of people, the delayed discharge, right, that we have in Morriston now, just Morriston, is around 100 people in that hospital that can't move on into the community because there's no care packages or there's no care workers for them. That's just 100 people in Morriston. Throughout Wales, you're talking about 1,300, 1,360, I think, people who are, you know, their discharge is delayed because there's no care package for them. Now, that's not an insurmountable problem for us. We're talking there about 400 care workers required across Wales in order to ensure that we can shift those people out of the hospital. What we've seen with this government is a sticking plaster approach where they have insourced, or in some cases outsourced, which is not a long-term solution. We need to make sure that that money now goes into long-term answers rather than buying in solutions from the outside.
Ian Chandler.
Yeah, I think that your question was specifically about social care rather than about health, so I'm going to try and stick to that. And I think we talk a lot, and I think it's been said here already, that, you know, about our social care system's broken. I don't believe our social care system is broken. I get sometimes quite cross when people talk about the NHS as the jewel in Britain's crown, going back to Bevan's time. But actually, social care, I think, is one of the jewels in Britain's crown, in terms of, you know, we have that ability to provide for our most vulnerable people. We keep children safe every day. We look after them when their families break down or when their parents can't look after them. We nurture them, we grow them into adults. We look after our adults whether they have mental or physical disabilities, whether they're getting old and frail, whether they have dementia. We look after them, we make sure they're safe, we try and do the best we can. I'm certainly not saying it's perfect, but I don't believe our system is broken. It is under threat, though, and I think that's what we really need to look at. I think there are a number of issues in social care that we've got to address. Yes, okay, we've got to be looking at funding, but we have got to look at some of the models, and it's going back to some of the other questions. Pay was mentioned. Social care workers, the issue of pay parity. A social worker, a care worker, working for a local authority gets paid less than the same qualified person working for a health board. We're losing people from local councils to health boards because the pays are better, but they're doing the same job. They're still doing the meds prompting and dispensing at people's homes. They're still doing all the social care assessments, all those types of things. And same with OT, same with others. So we've got to look at pay parity. We've got to look at national negotiation scales for that. We've got to be looking at other issues as well. We've talked about, so, delayed pathways of care. It's not as simple as Mabon said. Yes, there is a backlog of people that are needing care, but it's not. It's partly because actually there are real reasons for some of those delays. Because actually often it's the case that the family won't agree to a particular package because they've got to put some money in their pockets in order to do it. Sometimes it might be for other reasons, because the care is so complex that it needs more work on it. But there is a timetable, and we got constantly monitored on the number of days of delay. It's not that people are just sat there forever. It's about how many days of delay there. But
do the Greens commit to a long-term plan then?
Yeah, so the long-term plan is a holistic view of looking at all ends of it. But at the end of the day, it's also supporting social care to keep people safe. We talk about frailty. It's about, you know, I get loads of stuff. I see Jeremy Miles, he comes down and he has these 50-day challenges and stuff like that about looking at pathways of care. How can we get people quicker out of hospitals? But the quicker we get people out of hospitals, all we're doing is we're taking money, saving money for the health boards, but we're adding money to the local council budget because we're providing more care. We don't get measured on how many people we stop going into hospital because we're providing frailty services, because we're supporting people in their homes so that when they do have a fall, they don't go into hospital. They're looked after in their homes and they're able to regain and maintain their independence.
Okay,
That's what we need to be doing. We need to be looking at the whole system and not just cherry-picking certain aspects, certain metrics, and then trying to force people to work against those. Sorry.
That's okay.
I feel strongly about that one.
Steve.
I've heard lots of nice words from my fellow panel members, and I haven't heard any actual good solutions, because there is a financial crisis in social care. There are approximately 1,500 beds blocked tonight because people can't get into social care, and that does cost money to solve that problem. We're the only party who is being brave enough to say that we will have to increase taxes to pay for that social care. It is essential. It's not an easy choice. And I talked earlier about the social contract and the break in that social contract, which is currently happening. To take the risk to increase the rate of income tax, we have to then deliver social care which works for people, relieve the pressures in the NHS so it can give a good service. So it will take changes to the system. We desperately need to look at those referrals between the health boards and local authorities. There are still systems in place where it goes backwards and forwards multiple times on bits of paper or faxes or emails. And that's just not acceptable in a 21st century health and social care system.
Can I ask you, actually, you mentioned about using the Welsh ability to vary income tax. That would apply, I'm guessing, to the basic rate. That's how you get into the 200 figure?
It would applied to the basic rate.
I'm very excited here because this is a policy. And I'm very excited.
Unfortunately,
so just to be clear, what specifically
there
does that...
aren't enough rich people in Wales to make increasing their higher rates.
I'm not questioning that. What I'm questioning is what specifically does that money go on?
On social care.
What do you mean?
On providing councils with the funding to provide those social care services. Council budgets are massively stretched. So they're delaying providing social care because they're trying to patch their budgets.
Okay.
But it's also developing those integrated service hubs, which Ian spoke about, and I'm glad there's some agreement here.
Okay.
That will also feed into providing those social care services, those frailty services, providing that care in the community, providing community hospital beds that give that step-down service from that interim service between being in an acute hospital and being able to go back to your own home.
Okay.
There often has to be intermediate services, which needs funding for occupational health, it needs funding for physiotherapy and all those other things that people need.
All right.
Sorry, well, can I just...
Of course.
Just kind of one more thought, really. So we care for my parents-in-law, and so, you know, one of the things in Wales that we have, which is not in England, is that care at home is capped at £100 a week per person. You know, but also, again, I'll use an example from the Vale of Glamorgan. Our adult social services and our social workers that go out to talk to people like my in-laws and other people who, you know, hundreds of people that they're seeing on a weekly basis. They're using, increasingly now, they're using an AI system, which means that they can get people's notes, talk to people, record that much more quickly than they've ever been able to do before, which then frees time to do the personal bit of talking to people, but also means that they can see other people. So these are the kind of innovations that we are backing and that we are progressing in order to free up that time so that we are devoting that time to the people that need them in the way they need it.
Okay. Going to go on to another question. This one from Alan Trahan.
Thank you very much. I think, excuse me, I think Ruba just led into my question. So we started off talking about governance and the role of government, but my work as a clinician, I know there is a lot of red tape. I know there are a lot of restrictions. So with that in mind, my question is, what do you think are the barriers inhibiting innovation in the NHS in Wales, and particularly in my areas of community women's health, community gynecology, community medicine, but also digital innovation? And with that, if your party was elected, what difficult decisions, I'm going to put the emphasis on difficult, what difficult decisions would you take to try to overcome those barriers?
Okay, we'll go first to Ian. So Ian, what are the big barriers and what difficult decisions would you take to remove them?
I'm going to actually start off with the digital stuff because linking out the question, I just want to pick up with what Ruba said, because I think it's the digital side of Digital Health and Social Care Wales, the Department of NHS Wales, the Welsh Government, has been a complete disaster when it's come to looking at patient records. So the replacement for the Connecting Care digital record system has been absolutely atrocious in terms of it running on a system that's working on Microsoft Dynamics, when Microsoft said we're going to switch off the plug a decade ago, and they're still scrabbling around, and we're still trying to get money out of the Welsh Government to try and replace it. And actually local authorities and the Welsh Local Government Association have had to pick up the reins and actually do it ourselves because we've had such an appalling support from the Welsh Government on this one. And that went back when Eleanor Morgan was Cabinet Secretary, as well as now with Jeremy Miles. So I want to say that, but I do think digital innovation is really important because we do have to take that. But the problem is cumbersome bureaucracies that just seem to be very slow to move. I think the other barriers we're talking about, barriers of innovation, whether it's about the clinical side, or whether it's about the back office side, is again, it's the targets, it's the cherry picking of particular targets, particularly ones that maybe been driven by people like Will, who have focused on a particular metric, and then the government seems they've got to try and respond to that, rather than saying, no, actually, we're going to take the big picture here. There isn't enough devolution, I think, of opportunity. I think that opportunity of being able to create learning cultures, experimental cultures where actually people are encouraged to try innovation, where that innovation can then be captured and scaled up. We do have a lot of pilots, but pilots are very rarely scaled up because people write a nice report in them saying, yeah, that was really good. Oh, but there isn't any funding to take it forward. But we've got funding for another pilot over here.
So very quickly, what's the tough decision you're going to take as the Greens?
It's not one that you can actually put down. I mean, I know it's not a good politician's answer to say. It's not as simple as a big decision, because I think it is a cultural shift. So I'm not going to say that, but I would say that we would make sure that there is money within the system that allows for proper innovation to be piloted, but then to go beyond that and to look at how that can be introduced at scale, because that's where the real barrier is taking those good practices and scaling them up. And that's what I see as we really need to do.
Speaking as a journalist, I don't think one of the main problems is too much scrutiny of the Welsh NHS.
Yeah, but
no, I know, I'm being facetious.
Discharges of care and waiting lists and ambulances queuing up at A&E are a very easy thing to focus on. And then if you suddenly put all your attention on those things, then actually some of the really foundational stuff then gets neglected.
That's why we need these long-term plans. Ruba.
Yep.
So I'd be very interested to have a conversation with you about, what you think those challenges are. But I guess we've discussed one of those challenges. We've got an older population. That's, so in terms of, their digital savvy and all of those issues come from that. And I've discussed this as well. I think there is a cultural issue about making people talk to each other, and so whether social workers, clinicians, hospitals, and so on, and schools when it comes to children. This is a whole. We've talked about this earlier. A holistic approach. So for that holistic approach to work, everyone needs to be talking to each other, and those records need to be transferable between each. So one big challenge is, that your record can. So when my parents-in-law are seeing the GP, immediately the GP will see that they had a sore, whatever, three weeks ago, which, the district nurse dealt with, or, whatever it is, that you should be able to see those things, and that will make a difference. And again, that's where we're going. We are behind England, but given the fact that the system already exists, for me, we adopt that system and we use it. So I do think, that has been a challenge, but that's, we're moving to get over that. And I suppose, the last thing was really the biggest a challenge, and how, but for me, I think, I worked, I've worked for charities for a lot of my working life before coming into politics. I worked at Maternity Alliance and Disability Rights UK. So working around policy, but all around prevention, but all about people talking and that joined up thinking and working. And I think that, that still is. There needs to be that shift to enable that to happen, and that will be for the good of people. But again, we could give you lots of examples of that happening, around Wales, where that's working successfully to deliver for, individual patients or people that need social care, for example.
Thank you. Steve Ackley, Lib Dems.
Thanks, Will, and thanks for the question. I said at the beginning that health and social care is not I'm not the spokesperson for the Lib Dems. My area is actually entrepreneurship and innovation. And I think the Welsh NHS has a very mixed record of this, and I've seen this through my personal work with graduates who are coming up with innovative ideas which can revolutionise the healthcare. In some cases, the Welsh NHS has been very receptive and have supported some of those pilots, and those pilots have gone on to prove some good work. But in many cases, actually, the Welsh NHS has been very resistant to innovation. There is a very fixed mindset. Now, if Reform of the Conservatives were here, they'd probably be talking about middle management in the NHS and how we need to get rid of managers. And I actually think we need to empower managers, and we need to empower managers and train them how to adopt innovation, how to manage change, because we've got that a massive change situation happening. We're going to see massive and rapid changes to healthcare from a technological point of view, whether that's remote services and accessing services remotely. We've talked about specialist care in the home, but maybe that specialist doesn't need to be near the person. If there's a highly trained person next to the person, that specialist could be anywhere in the world if we adopt those services. AI is a huge thing, and the use of big data. And that's perhaps some of the big questions that you're talking about, because there are huge ethical questions on, do we just put everyone's patient's data into an AI system, and how do we control that? And are people comfortable with that?
Just very quickly, you're at time, but what is the biggest barrier, and how are you going to tackle it when it's a very difficult decision?
The biggest barrier is mindset.
Okay.
It's that innovation change mindset, and that is somewhat restricted due to regulation, and there has to be a cautious approach to risk. We're dealing with people's lives and health, but we do need to shift that mindset of understanding that risk and moving and adopting innovation more quickly.
Cool. Plaid Cymru's Mab and Gwynfor.
Yeah, this is a subject where I'm equally frustrated and excited about. You know, digitization and AI provides fantastic opportunities for us. First of all, I think we need to see a greater rollout of telemedicine. You know, they do that everywhere else, but for some reason we've not caught up properly. Telemedicine would be fantastic in ensuring that people who can't go to the surgery, who can't go to the hospital, can access some services, and making sure that that accessibility is there. But there's a reason why we've got this sort of divide in digital services in Wales. It's because about 5 years ago we saw the Digital Health and Care Wales body set up. Now, Digital Health and Care Wales deals with primary care, but the health boards deal with the hospitals and the secondary care. Hence why we've got a position where the digital systems don't talk to each other and they can't share data. So we need to get over that. That's talking about the tough decisions. That's one of the tough decisions and the barrier in front of us, that we have to make sure that they can share information and ensuring that the patient is empowered to allow that information to be shared. Now, I visited One London. Some of you might have come across One London. One London is a fantastic project which started some 8 or 9 years ago, where they didn't have a government or a political directive, but the health boards and health trusts came together, representing some 13 million patients, and said, this is what people expect. This is what the patients expect. They expect doctors to be able, or GPs to be able to share information with a clinician in the hospital, who can then share information with a physiotherapist or the occupational therapist, and these things are shared. So that's what they've done over a process of 8 years. It cost them something, the first 5 years, I think, cost them £25 million, right? And essentially, what we're looking at there is putting APIs, you know, a modular build, putting fix between different softwares so that it allows them to talk with each other. So we can do that here. So when I talk to the government and challenge the government and say, well, why can't we do it here? The government will come back and say, well, if we want an Estonia-type model, it's going to cost billions. I'm not talking about an Estonia-type model. I'm talking about a Wales-based model which learns from best practice from elsewhere. Finally, the other thing I would say is AI will transform and revolutionise how we can do some of the work that we're doing here. If we're looking at, in England, there are 45 million imaging tests there. AI can do all of that work in a blink of an eye and can do the work that humans are having to do at the moment and release some of the clinical or clinicians to do the work on the people rather than scan x-rays and scan images.
Okay. AI is going to be big. Okay. We're going to go on to a question now about prevention and personal responsibility. This question comes from Steve Curry.
Thank you. Well, good evening, panel. Yeah, I'd like to ask, do you believe that people in Wales should own their own health? If so, what practical steps would you take to ensure that they do so, focusing firstly on the people and communities that currently experience the worst health?
Okay, so the people in Wales need to own their own health, and the practical steps to ensure that if they do, how it will affect the poorer communities in terms of health outcomes. Mabon, we'll go back to you for this.
Yeah, first of all, this is a difficult question for me, and I'll tell you why. If I'm a historian, I studied history in university, and if you look at history, take Liverpool in the 1800s when you had a cholera outbreak. People were blaming the individuals for their ill health, saying that they made bad life decisions, that it was their fault. When actually a doctor came along and said, actually, it's not the individual's fault that they had cholera, it's the housing, it's the streets that they're living in, it's the dirty circumstances that they're in. So it took that responsibility away from the individual and said, actually, it's the broader determinants, the social determinants that are resulting in people's ill health. And I'm taking that same view towards this question. Yes, of course, people need to take responsibility for their health. Absolutely. We need to see people exercise more. We need to see people eat healthier. But if you're living in a poor community and you don't have that level of income, you don't have access to a park or a gym, you can't pay for the gym, you can't get access to what other people get, then you don't have much choice. If you're thinking about the housing situation in Wales at the moment, where people are having to live in hotels and they can't cook their own food. They've got to go out and buy fast food.
Is there a practical step you could take if you were in government to enable them to do that, beyond just more public
so
service?
when we look at the specific issue of allowing people or enabling people to take responsibility when they can, then of course we need to make sure that all the other structures in place whereby they can exercise, they can access cheaper, healthier food. But we're then talking about health literacy. People's understanding of their own health, people's understanding of what impacts on their health. And that means starting at a young age through education. It also means that we need to, going back to the previous question, use digitization and improve the NHS app that we have now so that it doesn't just allow you to book appointments, it allows you to learn from your own experiences. So you can input, as we're seeing in the private sector, they're doing it now, you can input what you've eaten, you can input how much you've slept, what exercise you've done, and you can learn from that. That's improving an individual's health literacy so that they can get better from their own experiences.
Okay, thank you. Stephen?
Thanks for the question. I agree with everything that Mabon says.
Oh, come on.
Yes, there is personal responsibility. People obviously do own their own health and they have the consequences of the decisions that they make towards their own health. But as Mabon said, when you're in a situation which doesn't allow you to make those decisions that are good for your health, then that becomes society's problem, not a problem of the individual. And we are in a situation, I'm in a situation in Caerphilly where the council are cutting and closing leisure centres, they're cutting and closing libraries, and they're cutting and closing those local resources that people can access. So we have to take a holistic view of health across the nation and look at the range of services which influence that. So it is about tackling poverty, it is about integrating more into the education system so that people are aware of the impact of the nutritional choices that they make and the impact of the choices around exercise that they make, as well as alcohol and drug use. To enable those services, we do need to invest in that, and it does need financial investment, which is why our plans on social care are intrinsic to solving those problems.
Brilliant. Ian?
Yeah, I think there's a real danger here, because I would agree. I don't think it's so easy to blame people for the health problems they have, by blaming them for their lifestyle factors, to use a nice neutral term. But I don't think that's helpful at all, because actually it's about what are the systemic reasons that people are like that. And we've talked a lot about poverty, but poverty is a multi-dimensional thing. It's about the housing people live in. It's about the transport that's available to them. It's about the jobs they have. It's about the education that they've had. It's also about the clean air and clean water that is around them or not around them because of their housing situation and all those types of things. The access to local shops, the access to shops that sell healthy, nutritious food at a decent price, particularly if you don't have your own car to be able to drive out to an out-of-town supermarket where things are cheaper. There's a whole range of different factors around here. So I do think we need to be looking at what are those enabling factors to remove the barriers from actually good choices. We want good, healthy choices to be the cheapest and easiest for people to take rather than the most expensive and most difficult. So we do have to change that system around it. And that's not going to be straightforward. But I think there's a number of things we can do. We can be trying to make sure that people have access to clean air, clean water, and a green environment where they can go out and actually get exercise that's going to help their both physical health and their mental health. We need to create opportunities for people to socialise, to get out of their homes, to be able to create so that support for community organisations, community groups. We do need libraries and leisure centres, but actually the people that are most need libraries and leisure centres are not the ones that ever go to them anyway, even if they're open. But they do go to things like sports clubs, they do go to other activities there. So we actually need to have a little bit less moral high ground about the types of activity we think is good and actually support the ones that don't. And then fundamentally, and we've got to take a long-term view about this, it's about the best start in life, and we have to tackle inequalities right from the very beginning, the first 1,000 days of someone's life, antenatally and postnatally. Things like breastfeeding. Wales has the lowest breastfeeding rate in the world. Appalling figures. When do we ever get to talk about that? The lowest breastfeeding rate in the world. We are not, as Welsh people, physiologically different to anybody else. It is because of the system is not enabling it. And it's not because people don't want to start. The initiation rate on breastfeeding is quite good. They don't sustain it beyond those first 6 weeks. Why? Because they don't get the support. We don't have the Sure Start centres. We don't have the proper health visitors. We don't have the public information support to make that happen. We have to tackle that. If we tackle that and that route, that has a knock-on effect for mental health. It has a knock-on effect in terms of reduced obesity rates
you're over time,
and all sorts of things like that. Sorry, I feel...
It turns out you're strongly about everything, from breastfeeding to public procurement. Everything we are passionate about
totally.
here. Fantastic. I mean, the question was about people.
I wanted to talk about breastfeeding, actually.
We could
the only woman here
I did want
breastfeed children.
Feel free to, take the question where you want to go. I just did want to say that this question wasn't about necessarily blaming people. It was about owning health,
right.
And I think there is a distinction, isn't there? But obviously, answer as you will.
So, where are you there? So, absolutely. So there are. I've talked about this already. So the determinants of life are, having a good job, income, your house, your environment. They're all things which will contribute to how you view yourself and your ability to have a life that's, that's full of well-being and fulfillment. And so they're really important. As I've said, that I think we're investing in those things to give people the jobs, to give people the ability to, have a warm home and so on. So they are important. Yes, there is. You do have personal responsibility, but that responsibility hangs by a thread when you're bombarded with adverts for, rubbish cereals or and so on the internet, on television, and so on. So, it's quite a battle for people to make those right choices, and sometimes they're not even real choices because you go to the supermarket and you buy what you can afford. So that's the reality of people's lives. If I could tell you, so one of the things, again, you'll all want to move to the Vale of Glamorgan, I'm pretty sure, because one of the things that we took a decision about was not to have any advertising for unhealthy foods on any of our bus stops that we owned, any public spaces that we own. There's no, we don't allow any advertising of that. So, you know, that's something, you know, you can do as a local authority and so on. And, you know, and that's really important. I do think we also have to take a handle on social media and this kind of bombardment of adverts constantly. Early years, and I would say this, wouldn't I? Because I did work for the Maternity Alliance and headed up the legal and policy there. It's crucial and critical. My children, because we lived in London at the time, benefited from the Sure Start system. So, you know, you have access to a health visitor, you have access to education from a very early age, and all of that is important. Breastfeeding is important. 6 weeks is as good as a year. You know, well, maybe a year is slightly better, but in terms of the benefit, you still get benefit from 6 weeks of breastfeeding to no weeks of breastfeeding. And women stop breastfeeding for all sorts of reasons. So, you know, it could be a lack of support, but it could be a personal choice. So, you know, these are factors that we have to take into account. So there are many factors. Early years, I would say, is a really good point to start.
Can I, because like your passion for this comes across, but so when I was researching for the book, which was shamelessly plugged earlier, thank you, I read 2 reports that the Welsh Government had done on breastfeeding. One was in the early 2000s under Rhodri Morgan, and the other was an action plan by Vaughan Gething. And the wording of those 2 documents were almost identical. There wasn't really any change in mentality, the solutions, the problems all seemed to be exactly the same, and they're almost 2 decades apart. Specifically, how does Labour, if you manage to get through the next election, you're in government still, how do you maintain, how do you change that energy and mentality when you've been in government so long on something like healthcare, which is so entrenched, the issues are so embedded? How does a party that's in power for so long kind of refresh itself?
Well, I mean, this new, the new intake of Welsh Labour candidates, like me, will be fresh. We will be new, and we've got more women, we've got people from diverse backgrounds. I think that will make a difference, because I think you're then speaking to people that have lived lives that are different from civil servants and so on. So I do think that will make a difference, and I think that will, that is about us listening to people, and they will have connections in communities, which means we do have to listen. But having said that, Eleni went on her listening tour of Wales, but a lot that is about listening to people and listening to what people want, need, and actually just what people need to tell you about their lives, and that could be for anything.
Can I jump back in one, please?
Go on then.
Because Ruba's talked about Labour listening, and today they sent out the new dental contract, giving dentists in Wales the weekend to look at the detail of that dental contract. Now, the dental surgery close to me has handed its contract back already, and I fear that on Monday morning, many more will be handed back. That could have been avoided, and it will need to be within that first 100 days of the Senate to readdress that contract and bring those dentists back into the NHS fold. And Labour haven't listened.
I'm actually going to withdraw my permission for that question, because I want to move on to Hannah Thomas. But I totally understand it, but I don't want it to be too question-timey. I'm never going to be a Fiona Bruce. Can we go to Hannah Thomas, who's got a question about health inequality, health equity and inequalities.
Thank you. So we know that health and care policies can sometimes widen inequalities that already exist in Wales. How will your plans and your proposals promote equity and ensure that no group is disadvantaged?
Okay, so we'll go to Ian first, so just to repeat that, because I think I was telling you were going to go when she was asking the question. How will you ensure your manifestos actively promote equity so that no group is unfairly disadvantaged?
So, I mean, we've touched on this quite a lot already, so I don't want to repeat myself. I think, though, it's good that you talked about equity and not equality. So, because I think that does mean it's about prioritising to where the needs are highest. And part of that is got to be data driven, and it is about actually, there is a wealth of data around there that we are maybe not utilising to the best extent. That data that's existing from all sorts of different sources, from postcode data right through to GP data and school data and everything else. We need to be able to get a good grip on that, to look at our targeting. So that is, yeah, targeting by postcode, but also targeting that in terms of those rings of intervention that we take through. It's, again, it's one of these things, though, there isn't a nice, snappy politician's answer, and I wish there was, but, you know, health and social care, I don't think, really lends itself to snappy answers, or if you come up with snappy answers, actually, you're probably missing the point. I would say that it is about, you know, as I've said before, it's about seeing the health and social care system as part of a bigger well-being system. It is about tackling poverty and inequality at its roots, not just in terms of tackling the symptoms of people that actually have poor health because of their poverty. So I'm not going to give that. I am going to say we will prioritise actually housing. We will prioritise good quality housing, both building more housing, bringing in rent control so people can afford decent housing, certainly investing hugely in retrofit so people have got warm housing, as well as obviously environmentally friendly housing. And we will be doing a lot around that, and we'll be investing heavily in public transport so people have got the ability to actually move around. People talk a lot about cars and roads and potholes, and frankly, as a councillor, I get loads of stuff around that. But actually, there are, you know, even in a fairly prosperous Monmouthshire, I forget what the figure is, I think 1 in 3 families don't own a car. And yet so much emphasis is put on actually car drivers rather than pedestrians and bus and train users. So we would do all of those sort of holistic things, looking at what do the people need. So sorry if that's a rather rounded and complex answer, but that's the reality of it.
If I could ask people to put your phones on silent, however hilarious your notifications are. Ruba?
So, yes, we do need to we need to target disadvantaged communities, or, you know, communities where, you know, incomes are lower, you know, people have lower outcomes or different outcomes generally. So things like Flying Start, for example, which, again, during the last 14 years, you know, a Welsh Labour government maintained that. And the ideal would be to extend that, so Sure Start, like Sure Start, which doesn't exist in England anymore, but again, now that Labour government are bringing that again. But, you know, Flying Start exists to address those kind of issues so that it is holistic, and you are giving everyone an opportunity. And the ideal would be that, you know, it's a community where everyone can go. So you could be in a middle-class family and go to Flying Start, as well as being, you know, from somewhere else, because that's how you raise everyone's opportunities. So, you know, inequality is structural. So I notice in this audience that there are very few BAME people, for example, in this audience. So we know from during COVID, that if you were from a black and minority or ethnic community, a minoritized community, you were going to have worse outcomes from COVID. And I feel that you know, those issues we're yet to address, I think, and that's something that I, as a member of the Senate, would want to see us move forward on, because, you know, we have the evidence and we need to start addressing those issues. So, you know, it is about, and I've said this in my opening, you know, it is about giving people better jobs, you know, jobs that pay, so they have those opportunities for a healthier lifestyle and for their well-being and for their families. It's about you know, building homes and having homes which they have access to, warm homes. And it's also about giving people the best start in life. I'm passionate about that. They should have the best start in life. And so I would like to see Flying Start rolled out across Wales. That's where I'd put money, from that magic money tree.
Steve.
Thanks. Once again, I think there'll be a lot of agreement amongst the panel on tackling those deep-seated problems, but I want to take my answer in a slightly different direction and then think about mental health and the parity of how we treat and deal with mental health and physical health, because still in Wales we don't treat them with parity. Somebody who has got mental health problems will be stuck on an even longer waiting list and probably not get the greatest of service. Perhaps some drugs to suppress the treatment rather than the cognitive treatments that they need to improve their mental health. So what the Lib Dems will do, and this is especially around access to that mental health support for young people and in rural areas, mental health within the farming community is a huge challenge in Wales. We would commit to ensure that there are mental health counsellors available in all schools so that children, when they need it, and children and teenagers and young people can access mental health services so that they get that best start in life and end up in a situation where they have good mental health as well as good physical health. Again, we've talked a lot about prevention and putting a preventative NHS in place, a national, a holistic service, and thinking about how we ensure that people have good mental health and are aware of how the actions they need to take to maintain their mental health is really important, and that is something that is high up on our priorities list.
Okay,
I think I'll split this into two responses. First of all, we know from the work of Julian Tudor-Hart here in the Welsh Valleys, in Ogmore and Bridgend, that there's a clear link between deprivation and poor health outcomes. So we need to make sure that the resources go to the right places. And that means if we're going to shift resources from secondary care to primary care, part of that has to be looking at the Cahill formula, you know, the funding of GP services, so that the money goes to those areas that need it most, so that people do get see improved outcomes. Secondly, last year we had this Welsh Government introduce the Women's Health Plan. Fantastic, long awaited. A lot of that came from some work we did in the Health Committee looking at gynecological cancers, which was, you know, really frightening, the fact that women were just not listened to. And, you know, people know their own bodies better than anybody else, and we need to take the voice of the patient seriously. So learning from that experience, we need to roll that sort of project out to have global majority health plans, children's health plan, and an elderly health plan. So if you're thinking about the global majority health plan at the moment, we've got Ramadan coming up. Now, if you're a diabetic and you're going into Ramadan, do the GPs surgeries and do the GPs understand how to look after that patient if they're going to be fasting? No, they don't at the moment. So we need to improve education. The only way we can do that is to identify where the problems are by getting these plans together and then putting the resources in place to respond.
Okay. I'm super conscious about time. I don't know how we'd have done this with 2 extra people, so thank you to Reform and Conservatives. But I'm going to go to one more question because I really want to get to this. On the strict proviso, you all just do 30 seconds. However passionate you are, just do 30 seconds. Okay, it was to be asked by Felice Selick, but she was unable to be here, so Jules is going to ask this on her behalf.
Yeah, hi. What approaches can we adopt to frame mental health in a way that emphasises social and relational determinants of stress alongside symptom management to be able to support a more holistic and sustainable service model?
Well, it was very mean of me to make this a 30-second answer, but Ruba, would you go first, please?
You've mentioned, you know, young people and mental health, for example, because, you know, we post-COVID, we're still recovering from lots of the impact on in our young population, for example, around mental health. And so, you know, we are putting money into having in schools so that schools have somewhere for children to receive that support. But it is holistic, so it is connecting up with you know, social services as well. For emergency mental health, it should be seen within 28 days. So that, you know, the what is it, 2, isn't it? The
1+2.
1+2. Thank you. So, you know, so these are things. So, you know, it's a really, really important question, and the issue is really important because, you know, we need to look at, you know, we have to be able to provide support for people, whether they're young people, whether they're older people, to, you know, to live their lives. So if there are acute issues will be treated differently, but there will be plenty of people who will be able to, as you say,
Sorry, I'm going to have to... Sorry, I
who,
know.
who will be able to be supported to work, to go to school, and so on. And, you know, that's what we're attempting to do with that particular pilot.
Mabon Okgumbo.
Yeah, I'll try and be short, but mental health, at the moment, whenever we discuss mental health issues, we always discuss it in the context of the acute and the crisis stage, and that's where all the resources go, and that's where they shouldn't go. So I will be repeating myself. It does mean shifting resources, putting things upstream, tackling an issue before it becomes a problem. So that means shifting resources into the community more, so that we've got more nurses in the community, more psychiatrists working in the community. Then you've got a question there around workforce. There's a lack of data on the workforce at the moment. Actually, with psychiatrists, we know that we don't have enough. So it's a case of getting a clear workforce plan in place so that we have those community-based resources that can tackle an issue before it becomes to that acute and crisis stage.
Thank you. Let's go to Ian.
Yeah, I mean, I agree with that in terms of we've got to move further upstream away from the crisis into probably rapid early support, local mental health early support services. We need those. But I think we also need to be doing more targeting. I mean, we do talk about child and adolescent mental health services, CAM services, you know, and they exist. They're as underfunded, they need to be expanded, but actually it's not just a matter of funding, it's a matter of actually having the practitioners that we can employ doing that, because there is a shortage of practitioners there. So we do need to do that. But I think we also need to look at targeting in different ways, whether it's data-driven or whether it's actually looking at different demographics, because although we talk about children's mental health, actually there are two particular demographics we need to look at. It's women's mental health, particularly perinatal mental health. We've got to do more to support women after childbirth to support their mental health. And then we've got to have a gendered approach to men as well, because men, particularly middle-aged men, have the highest rate of suicide in the country. And if we look at the government's mental health strategy, it doesn't mention men once.
Thank you. And Steve.
I'll be as quick as I can. Increase access to and awareness of social prescribing and those early measures which can prevent a mental health crisis from happening by ensuring that people are connected to their communities. So empowering GPs to be able to direct funding to services such as Men Talk Walk or Men's Sheds, and directing their patients to those services as an early prevention measure. I'll be quick. Access to and funding of social prescribing, but at the same time measuring the impact of that, collecting the necessary data so that we can prove that those approaches work. Now, there's strong data that says they do, but they're also a little bit woke. And we need to be able to evidence that those woke approaches do work. They make people's health better. They prevent expensive interventions later on in people's lives.
Okay, we are at time, so there is now going to, each of the participants is going to have 30 seconds, a very aggressively policed 30 seconds, to make their final elevator pitch. So this is essentially, what does a vote for your party mean for healthcare in Wales? We'll start with you.
Okay, cool, 30 seconds. If we continue to run the NHS as an illness service, demand will always outstrip supply. So the Green Party's message is simple. Let's build a system designed to keep people well, not just to treat them when they break. Prevention, integration, equity, and long-term accountability align to the Future Generations Act. A health and care system focused on human thriving is not only fairer, it's the only model that is sustainable. So vote Green. Thank you.
Thank you. Steve.
A vote for the Liberal Democrats will get you a champion in the Senedd who will stand up for the needs of the health and social care system. We'll fight to make sure that it's funded properly so that it can provide the service that it needs to provide. It's something that our party care deeply about. We champion it in Westminster, we champion it in the Senate. So vote for the Lib Dems and allow us to continue to raise your voices in that Senate format. I probably should have prepared that one in advance, shouldn't I?
It's very organic. Mabon Plaid
We can't spend our way out of the problems that we have in health and social care. First of all, we don't have the levers of powers to do that entirely, so we've got to work within the powers that we've got, and we shouldn't just expect to manage decline. We need to improve health and care by listening to the workforce and listening to the patients, identifying the causes before they become an issue, valuing the workforce, improving digitisation and data, using that data properly, and then promoting the preventative agendas so that we can tackle things before they become a crisis. That's why if you put Plaid Cymru in charge, we will see improved outcomes.
And finally, Ruba from Welsh Labour.
So I want a Welsh Labour-led Senate because it makes a real difference to people's lives. We protect services when pressure is at its highest, invest where it matters in health, education, housing, jobs, and we innovate to tackle inequality. Today, in fact, Welsh Government have announced that all NHS staff on the Agenda for Change terms in Wales will receive a pay rise of 3.3%, with the lowest paid getting 3.8 to 5.9% rise. And that reflects our commitment to the real living wage. That's the Wales I want to fight for, fair, strong and delivering for everyone, not just a few.
Just for some closing remarks, I'm going to hand over to Sue Evans, who is one of the Bevan commissioners. But thank you very much for having me, and I'll hand over to Sue now.
On behalf of the Bevan Commission, can I thank you all for giving up your valuable time to be here. A special thanks to those people who took the time to raise questions and to ask those questions. So fantastic questions, diversity of subjects, which I think is what we were looking for. So thank you very much. And special thanks to our political colleagues here who really put themselves in the firing line, given us some real food for thought in terms of their policies. Hopefully those discussions will help you with your vote in May. I'm not going to declare who I liked best. That wouldn't be proper. But, you know, there's been some new faces in the audience and in the panel, and they've stood up and put themselves forward with some really clear feedback and answers to your questions. So a real big thank you. And lastly, but not least, Will, where have you gone? There you are. Thank you for comparing and chairing this really good event. So safe journey home, everybody, and come back next time. Thank you.